Hello, everyone. I'm Craig Norman, and welcome to the Euclid Systems video chats. We're really excited to have you here today, and we think that your time will be well spent in the conversation we're going to have this afternoon about managing COVID-19 through the eyes of an optometrist CEO who happens to be in that role of Euclid Systems. I would like to mention, if you have any comments or questions, please write them into Facebook. We will try to address them as we go throughout this afternoon's discussion. I'm really pleased to welcome Dr. Joe Boorady for this afternoon. He has a really unbelievable background. As a really young man, he worked for his father in the optometry office. He went on to be in academics. He was a practice owner, a practice builder. He's been an entrepreneur. He's been an investor. And now he has taken over just fairly recently as the interim CEO at Euclid Systems. Dr. Boorady, welcome. How are you today?
Thank you. Thank you for having me, and I'm doing fantastic. I hope you are as well.
I am pretty good. Pretty good. Thank you, all things concerned.
Yeah.
So can we just start with the thing that's on everybody's top of mind right now, and that is relative to COVID-19, and from your chair as a CEO, what does all of this mean to you and to Euclid Systems?
Yeah, no, that's a great question, and certainly on the top of everyone's mind. You know, the 2019 novel coronavirus has impacted almost every corner of the world, and virtually every business has been impacted one way or the other. I personally find it very humbling in many ways, and my respect for the power of nature has never been greater. But that said, equally, the power of humanity, and throughout history, we've been able to find ways to overcome and thrive after such adversities. And so I'm extremely optimistic that this is no exception. We'll find our way through this. Certainly for a company like Euclid, we've had disruption in our global business as every other company has experienced. And we've, first, when we identified the nature of this, our primary concern was our employees. So we first and foremost tried to ensure that the safety of all of our employees was paramount. And we worked very hard to ensure that they and their families were going to be safe from this. So our most precious assets are our people, and that was our initial reaction, initial priority. Simultaneously, we really focused on our customers and what this meant for them. And we wanted to ensure that they were going to deal with the crisis well. So we, as a leadership team, sat down very early on in January and focused on, the China business first and foremost, and then extrapolating that to global, including the US. So we were, I would say, one of the first ophthalmic companies in the market to immediately implement many new policies to support our customers. We extended our call center hours to have better availability for our customers, to answer questions and to support them. We extended things like payment terms for our customers to allow more flexibility. We extended our product warranty, knowing that there was going to be disruption in the practices. We implemented a discounted emergency spare pair program and felt that that would help to support the patients to ensure that they had an adequate supply. And in addition, we immediately started working on more digital programs in order to have that vehicle to communicate, knowing we wouldn't be face-to-face with our customers as often. And so webinars and events like this, Facebook Live events, are vehicles that we've been using to communicate, kind of change the way we do business. And I would say lastly, we looked at opportunities to come back from this stronger as a company. And so we looked to see how can we overcome this and also be prepared for the other side of this. And so unlike some companies that may need to lay off employees, we've been investing. So we're hiring a third shift of manufacturing employees so that we can manufacture lenses around the clock and have 3 shifts of manufacturing, knowing that on the other side of this, there's going to be an increased demand. We've upgraded our manufacturing capacity by acquiring new equipment, including automation equipment. And our goal is to be better and faster on the other side of this, so that we can certainly improve ourselves as an organization and prepare ourselves for the post-COVID days. And so that's kind of been our strategy and how we've looked at it.
That's terrific. And, for instance, because of the China connection, and I'm going to ask you here in a second to expound upon that, if you will, but you actually had a little bit of insight because China was affected first. And then, of course, now it looks like China might be coming out of this first.
Yeah.
And, could you just tell us a little bit about that?
Yeah, no, absolutely. So, in the early days of this virus, we had some indications. So we actually have Euclid employees that live in Wuhan, the epicenter of this, and were, forced to self-quarantine for many, many weeks. Really, Wuhan just opened up last week, from January till now. So we had weekly, if not more frequently, interactions with that employee, getting a play-by-play in the very early days. And so I would say we did have very good insight. We were very fortunate to be able to follow this closely there and get it on the ground, not necessarily from the daily news, but from the horse's mouth, if you will, right from our employees based in throughout China. Our main headquarters there is in Shanghai, but like I said, we have employees that come from all over the country, and we're able to get really good insight from what's happening around there. And it gave us a sense of what could happen in the US very early on, knowing that there are these epicenters or hotspots, if you will, and that we will be impacted differently as a global company, but also here locally as well in the US, and where our majority of our employees and certainly our manufacturing is. And so we were able to do planning very early on in this process and be able to get a little bit of visibility and maybe a head start in some ways preparing. And
Sure.
So I would say it really helped us to prepare. Some of the insights we learned from it is that there is another side to this. There is a bell-shaped curve, as you may have heard from the coronavirus task force. There's this bell-shaped curve that we see around the world with the cases going up, hitting a plateau, and then there's another side. And we see China business pretty much back to normal, very, very close to the pre-COVID timeframe. We are seeing our number of contact lens orders, the number of patients going in for orthokeratology and other routine procedures has gone back to normal. Certainly life in China is not 100% back to normal. There's still aspects of social distancing and wearing masks in public, and some things like schools are still closed. But hospitals, healthcare facilities are broadly open for general procedures, things like that. And so we can sort of envision and see how that could happen here in the US as well, and the effects of potentially a rebound as well. And we're seeing a little bit of a rebound happening in China today, but certainly not to the extent it occurred in the first place. So we're hoping that rebound is minimal. You could expect some sort of rebound when you open things back up. It makes sense. But we're hoping that even if we do see that in the US, it will not create these hotspots and high levels of contagion, because people are still protecting themselves using hand sanitizer and using good general precaution.
Yeah. I think that's tremendous insight from the standpoint of, we view things so locally and provincially, just what's affecting us. But we can look at something like what is happening in Wuhan and the surrounding areas, which aren't as affected as much as what Wuhan was, and get somewhat of an idea on how to get out of there. And I know you mentioned the bell curve, of course. I think that we've all learned more about bell curves and flattening the curves that we ever want to hear again. And so I'm curious. So, you've been at other companies, you were at Tier Science. You led that through a successful sale and then stuck around for J&J for a little while after that. And you've done other things, not only just as an entrepreneur, but also as an executive. What really interested you of coming to work in this industry, the myopia management industry, and for a company like Euclid Systems?
Yeah, no, that's a great question as well. I would say that when the opportunity presented, a few things really got me excited. So first of all, the longstanding history of Euclid Systems was very interesting to me, knowing that it was a 25-year-old company in this space that is really just starting to mushroom. I thought was very intriguing and definitely wanted to learn more about the insights of a company that's had myopia in their DNA for so many years and has really been focused on this problem. So in many ways, the company was ahead of its time and way before myopia and high myopia became thought of as such a major public health issue around the world and certainly in Asia. Second to me was the leadership team. So once I learned about the company, I came in and wanted to meet the leadership team and really understand the talent that we have because as I said earlier, really the best assets of any company are its talent pool. And I wanted to ensure that that was strong at Euclid, and it was an amazing team, some employees dating back to the beginning of the company. And so for me, that was really important to be able to work with people who really understood and had passion around this condition. And I think finally, as an optometrist, what sealed the deal is the need to act and to help promote awareness and education and technology in a growing marketplace, in a space within the profession that I felt was underserved. And I think very much the same in ocular surface health, like with tear science. You see it growing, not just in the entire population, but in the younger populations, which is really striking for me. It was really eye-opening at tear science and then even here at Euclid to see the number of very young children who have very advanced disease. And I just wouldn't think of seeing severe dry eye disease in a 6 or 7 or 8 or 9-year-old child. But because digital technology has really become so pervasive and really has infiltrated every aspect of our lives at such a young age, we're seeing the sequelae of that in so many different ways. And certainly myopia is one of those, ocular surface health is another. And so those are areas that I see not improving anytime soon, and where a lot more science and understanding and need for technology is continuing to expand. And so I love being in fast-moving, fast-growing areas like this, where I think the time is right. And so the time is certainly right for ocular surface health today, more so than it was 20 or 25 years ago. And I see the same thing in myopia management. We're learning so much more. The science is advancing quickly. The technology, both diagnostics and therapeutics, requires a lot more investment and innovation. And so for me, it's exciting, it's fun, and I love those types of opportunities. And so when this presented, I threw my hat in and was happy to be part of that.
Sure. Like, for instance, I'm sensing that when you were still involved with SUNY and still had the academician hat on, one never really looked at myopia as a disease. It was, a refractive error, and you just fixed it a couple different ways. And then surgery came along, so you had 3.
Yeah.
And you never really looked at it the same way we look at it today. And the numbers are astronomical if you project to 2040, 2050 and beyond on what the impact is of myopia across the globe.
Yeah, no, you're exactly right, Craig. And so that's, that's fundamentally what got me so interested in the opportunity. And I agree with you. Back when we were in optometry school, it wasn't thought of the same way, and that's okay. I mean, the digital technology wasn't as pervasive back then, and now we see the effects of environment on our visual system, and so yeah, for me, it's just a fast-growing, large market opportunity to be part of ocular surface or myopia or even other conditions in eye care. And those are the niches that I love to spend my time in and trying to have some sort of impact on.
Right.
Really exciting.
It's very interesting what you say there, because of course, in essence, ocular surface disease, we kind of push, towards more elderly, and I don't mean more elderly, but older patients.
Yeah.
And Ortho-K, primarily in myopia management, is for kids. But in fact, if there's somewhat of a crossover there at the same time, I mean, I wouldn't necessarily call it an opportunity, but it's a discovery that can be extremely helpful to patients for a lot of their life.
That's right. Yeah. And they do go hand in hand. They're both related to, we're seeing ocular surface in younger people, and we're seeing more severe myopia and higher amounts of myopia in younger people. And I think both of those trends, where you normally would see them several decades later in life, that timeline is being moved to a much younger age. And I don't think we fully understand, what does that mean? What does that mean when a 6 or 8 year old starts to develop myopia rapidly, and their meibomian glands are not functioning well any longer? And what's that person's life going to be at age 20?
Yeah,
those are the types of questions I think that we need to figure out quickly, have answers to, and find solutions. Technology, diagnostics, and therapeutics to be able to detect these early and find good treatment options that are safe and effective for those populations. It's our most
the digital devices, they've changed things so dramatically, that the life, of young children spent on them is so different than, being a child, 2 or 3 or 4 decades ago. I always like to share a quick story. One of my grandchildren called me up one day and said, "Hey, I got a grand slam home run today playing baseball." I said, "That's great. Who did you play against?" And he said, "Well, I didn't play against anybody. I did it on MLB.com." And it wasn't even part of his structure, but that was an accomplishment to be able to get a grand slam, which is something I could never think of on a game. I always wanted to be able to do it as a kid playing baseball itself.
Yeah.
You talked a little bit historically. It's kind of interesting. I've had the opportunity to know that some of the originators, George Glady, Joanne Simonson of Euclid, for many years. And the company's been in business for 25 years. And the China experience is now 10 or 10 plus. Is that correct?
Yeah, 10 years. This is our 25th anniversary for the founding of Euclid, and the 10-year anniversary of our founding of Euclid China. It's a separate legal entity, but part of Euclid. And so,
that's tremendous. And I know I've heard a number said on a couple of occasions that Euclid lenses in China have been fit on approximately 2 million eyes.
That's right.
Which is incredible. I mean, that's an incredible number to be able to fathom from our perspective.
Yeah, we're really one of the fastest growing Ortho-K designs in the United States today, and we're the #1 imported Ortho-K design in China. So we've had a really lucky history there. We're very fortunate. We take that responsibility very seriously as a market leader, and very proud of the long history and the long DNA in our company, that we have a lot of passion and a lot of long history in the fight against myopia, and to help manage this condition with some innovative designs. And so we're very proud of that history.
Yeah. So if I could switch gears for just a second, and actually I want you to switch gears also and take your CEO hat off. And if you would put your optometrist hat on, and if you were in practice today, or as you did at one point manage multiple practices, how would you be working your way through the madness we're living in at the moment?
Yeah. Okay. Well, that's a great question. I would say first and foremost, I've always been an early adopter of technology. I remember implementing my first electronic medical record in the early 90s. Working with companies in the very early days to develop EMRs when there were really none or very few for the eye care profession. I remember working with OfficeMate in 1993 to help start developing an electronic medical record and so forth. So for me, I've always loved technology. It's what always interested me in the eye care profession is we get to use so many cool toys, if you will, in examining patients and so forth. So technology is my passion in many ways. And so I would really be focused on how to use technology to manage through this crisis. And I think the COVID crisis is a perfect opportunity for technology. So thinking about telemedicine today, thinking about how to use the website. There's some great live chat bots that you can have on your website where you can have live chatters. Essentially, I think of it as a virtual front desk. So having trained people who are live, who are able to communicate with my patients through the website, through telemedicine, for me to be able to help answer questions and solve problems. I'm doing a little telemedicine now, unofficially, just with family members who call and say, "Hey, I can't get in to see my eye doctor, but I have this red spot on the white part of my eye. What do I do?" And I ask them to FaceTime and so forth. So formalizing that, doing that in a practice, and having a way. There are billable codes for that today. So it's a little bit outside of our comfort zone. We are very used to being in the office face to face with patients, but I would be finding ways to use telehealth vehicles, chatbots, telemedicine, and so forth to be able to communicate. I would also be thinking forward quite a bit. So what will life look like after this? There's certainly many people economically impacted by this. So thinking about payment plans for, we are dealing with expensive technologies, Ortho-K, eyeglasses, contact lenses, all are real, significant dollars. So there may be people without health insurance now. There may be people just struggling to get back on their feet. So finding a way to accommodate them, being prepared for that, not surprised on the other end of this, that the people's financial situation may have changed over the last couple of months. I'd be looking at office improvements during this time. The office is empty now. What a great opportunity to put in that new carpet or to really prepare the office for the post-COVID days. So start acquiring stand-mounted hand sanitizer stations. So when patients come in, they can use the hand sanitizer before they start filling out their forms, or having my waiting room spread out a little bit more, spreading out the chairs rather than right on top of each other, which probably most waiting rooms have. Spreading that out and putting tables in between, or ways to kind of force the social distancing. So those are the things that I would be thinking of if I were in practice today. And that's not only how is this impacting me, or how can I help my patients through this and employees, but on the other side of it, how can I be prepared for that, post-COVID mindset where people are still going to be concerned about catching viruses, even after people are allowed to go back into the office. So we have to deal with that head on and be prepared. And so I think that's where my head would be.
Yeah, exactly. I mean, I totally agree. I don't think one should sit back and go into the woe is me syndrome. No. And, because when things begin to turn around, creativity is going to be vital. And there's a lot of discussion on what to do, but until we're really in there as an industry, rolling our sleeves up literally and gloving and everything else that we're going to need to do, that's going to be a change of pace, but that'll critically change things.
Yeah.
And then patients are going to view things different. And just to build on something like you talk about telehealth or telemedicine, a year or two ago, it's commonly said there's no place for it in the practice. The patients don't want it. We don't need it. And both those things are wrong today.
Yeah.
Patients want it.
I think it's going to be the new normal in many ways too. I can see in the future, you have downtime in your office. There's an hour there where you may not have, a no-show or whatever happens. You just move over to telemedicine. Go sit in your office, turn on your screen, and if people need help, they may want to remote in and ask some. And it's billable time. You can make great use of that time in between. And so I can see us evolving to that now that, even the work from home thought process, do you need everyone in the office, or are there people who can work from home? You're billing people, you're scheduling people. Do they really need to come into the office, or can they remote in and have access to technology? I think the mindset's going to change dramatically after this. And you know, in some ways for the better, you know, really
Yeah.
to become more efficient.
I mean, at the very least, telemedicine can be triage. I mean, at the very least, you know. And
Yeah,
so one last question:
sure.
do you miss seeing patients?
I get that question often. The last patient I saw, I think, was 2006. So it's been a while. And I have to say, yes. I mean, I do miss that patient interaction. That just the urge for that. I don't think ever goes away. But I think what placates that a bit, or what satisfies me, is really knowing that I'm able to help deliver great technologies to the market, still be part of the profession, and bring products and services and you know, diagnostics and therapeutics into the hands of millions. And to me, that's really satisfying, because I know still every day I'm helping to improve the human condition, helping to preserve vision and the precious gift of sight. And that's why I went into this in the first place. So I'm still very passionate about that, still very involved in that. And so for me, that sort of satisfies that urge to help
Well, for
patients
sure.
every day.
I mean, the impact is not seeing people one at a time, but millions at a time that you're able to help through the technologies you've been involved in. So we're going to wrap things up now. But before we do you have any comments that you would like to close with?
For me, it's really just thanking you and thanking all the other thought leaders and influencers in eye care that have been out there really helping to navigate this difficult crisis. I'm very appreciative of just all the support we've gotten from our wonderful customer base and you know, the people who rely on us. And I hope that we're doing a great job as a company. I'm very sincerely hope that we've done everything we can as a corporation to support our customers and our employees. And I hope everyone else is doing the same. And I see this bringing out the best in many people, and certainly appreciate the time with you today as well.
Well, thank you. I know that you have a really busy schedule, and I think for our audience, and really for me, it's been great to hear more about your story. It's so interesting, and also what's happening at Euclid, both here domestically and in China alike. Thank you so much, Joe. Also, for those of you viewing, I'd like to remind you that this Thursday afternoon at 1:30, there will also be another one of these events. Dr. Rob Garowitz and Dr. Trevor Fossel will be our guests, where we're discussing home alone, what it's like to be remotely separated and worrying about your patients, your family, and yourself. So thank you very much. And we hope to see you once again. And finally, thank you again, Dr. Joseph Boorady.
Thank you.